Now, the South African Medical Association, or SAMA, say that calls from several quarters of society for level 5 lockdown to be reinstated is actually counterproductive and will not yield meaningful results in the fight against COVID-19. Now, there have been calls from different organizations for a harder lockdown due to the sharp increase in COVID-19 infections and also fatalities. And there also are thoughts, and people are saying that a more sensible approach to the COVID-19 pandemic would be for government to prioritise and strengthen health facilities and vaccinate. The Medical Association also warns that if government does not heed the plight of doctors about their working circumstances, the country will soon face a situation of doctors who suffer from, among other things, burnout. And Dr. Angelique Coetzee, the chairperson of SAMA, joins us now to discuss some of these further. Dr. Coetzee, welcome to Morning Live, and thanks for your time.
Thank you so much, and it's good morning to all your viewers out there. Yes, you are correct. SAMA is of the opinion that a harder lockdown will not add any more would not add any more meaningful results in our fight against COVID-19. It is important to understand that this virus is already out there. It is a highly contagious virus, and it's highly transmittable.
Well, our apologies there.
To make sure that the healthcare systems.
Our apologies there, Dr. Coetzee, just seemingly a bit of a network problem where the signal seems to be cutting out. But you were saying, of course, the personal protective equipment issue is one, and, you know, talking about a burnout that could result as you see more and more cases of COVID-19 on the front lines.
Yeah. Yes, we did say that, and we stick with that. It is extremely important to to make sure that our healthcare system is protected by making sure, as you've correctly said, that the PPEs are there. To say to us that you are only having 90 or 85% PPEs, it's not good enough. It must be 100%. And we also realized that there's huge pressure on the oxygen delivery to the hospitals, as well as the pressure of the oxygen, as oxygen is the primary treatment of patients having COVID-19 admitted to hospitals.
So as we speak right now, I remember last week there was a bit of a focus on oxygen in the Western Cape. But overall, if you look at a national picture, what is the situation in hospitals, both public and private, Dr. Coetzee?
Well, I'm quite sure all of you are aware of or saw some of the pictures from Steve Biko Academic Hospital that was in newspapers and the social media during the weekend. This actually, I know that they are a tertiary hospital, but you know, if the secondary hospitals had enough oxygen, had enough ports, had enough trained nursing staff for ICU and high care doctors, they could have easily been treated at those facilities. So now what we end up with is the overburden on one big facility needing to try to cope with COVID-19 and all the other patients that's still coming into that hospitals.
Now, given these concerns as expressed about oxygen, about PPEs, among others, have you spoken to government? Have they acted on your calls? And also, some doctors are saying their complaints about their circumstances are not being heard. Can you please elaborate on that aspect as well? And, you know, what the doctors' complaints are in terms of moving forward from this stage?
So what is extremely important to understand is that, yes, from SAMA's side, we engage with the Northern Cape And we are very happy to say that we solved the post of 35 doctors that was frozen there. And again, we are grateful for that. We asked to meet with the MEC of KwaZulu-Natal. We're still waiting her response. It's now a few days. We asked to speak with the MEC of Eastern Cape. She told us that she was very busy and couldn't meet with us before the 15th of December. So that was when we already reached out to them. We're still waiting for them. So, it makes it extremely difficult. If we want to be reaching out and the MECs of provinces are not really willing to come to the party, and once if we are saying that there's a problem, they, especially the MEC in KwaZulu-Natal, is accusing SAMA of instigating a lot of fear out there, and we should not add to fear out there. But all that we are saying is there's a problem. Just please acknowledge that there's a problem. And once if you have acknowledged that there's a problem, let us all work together to try to fix this problem. We would not have had this problem if there was proper preparation for a second wave. We all knew that the second wave was going to happen. Now we are in a second wave with a highly transmittable virus, and still, it is as if the urgency of this is not well understood.
So why do you believe that to be the case? Because I think government, when we speak to them, certainly seem to acknowledge that there are problems. One gets the sense that there is a will to address these problems. Because I see you've also called, as SAMA, on government to employ more doctors. Can you tell us more about that as well?
Mm-hmm. Okay, our plea is not even to employ more doctors. Our plea is to open up the posts that has been frozen for more than a year in most of these provinces. And the provinces is not being honest by saying how many posts has been frozen out in the public, admitting that, we already starting with a backlog of doctors regarding allocated posts that's not been filled. So if you don't fill those posts, how do you want in a pandemic people, doctors and nursing staff to give care? It's not only doctors, it's also nurses. I'm not sure about other allied workers, whether their posts are frozen as well, but we know for a fact that doctors' posts are frozen.
So with regard to that, what has government's response been to you as SAMA? Are they willing to do that? And also, many people have been asking about the Cuban doctors who came into South Africa. Are all of them still here, and where are they at this point?
As far as SAMA's knowledge, they are here. Where they are, we don't know, and what they do, we don't know. Also, those questions is very difficult. You can't get straight answers from the various provinces.
So we understand that there's also...
Remember, this is a province problem.
Mm-hmm.
It's not a problem of a national Department of Health. Provinces are autonomic in how they autonomous in how they handle their affairs, financial affairs, their hiring of doctors, nurses. So it comes back to the premier, the MEC of provinces should be held responsible for lack of posts, lack of funding, posts that's been frozen.
So again, with regard to employing of more healthcare workers across the board, and we've heard from government, we've seen now with the procurement of vaccines, for example, cost is always a factor. So in terms of absorbing this cost, has SAMA actually applied its mind to that? How should that work, and does government actually have the funds to do this?
Well, it's difficult to say whether government has the funds to do this. We presume they must have funds. What they do with the funds is something differently. And this is a question that that actually needs to be posed to Treasury. Between Treasury and Provincial Department of Health, there should be an investigation into all these posts that's been frozen and what happened to that money. And it should not be SAMA's problem, whether there's enough money or not. My problem is to make sure that the conditions in which my doctors are working are conducive for them to give good quality health care. Not to worry whether the government's got enough money. That's not my problem. That's not my primary function. That's the function of government, to make sure that the fees are there.
So just moving forward and looking to the vaccination program now, and we understand that before the end of this month, we will receive a first batch and then another batch in February. And of course, healthcare workers will be first in line to receive this vaccination. Just your thoughts on this, Dr. Coetzee, and also with regard to the rollout and how it's going to take place. Do you have any further clarity on exactly how the plan will work?
We attended a meeting on Friday afternoon where the rollout has been discussed with us. SAMA's got great concerns regarding the rollout. It's a very nice plan on paper. The problem is going to lie when we need to implement it, because in the public sector, they're going to follow their normal, usual procedures that they would use for children's vaccination. That model will be followed. How it's going to work in the private sector, we don't have a cooking clue. And that is of huge concern to us. So the detail is not there.
So as you understand it right now, the minister did say we should know within days at the point that we spoke to him exactly when to expect the first batch of vaccines. Do we know at this point? Have you had any word as SAMA?
No, we don't know at this point. You need to understand we are nearly in the middle of this month. There's 2 weeks left of this month. So if you want to bring in the vaccines before the end of this month, there's 2 weeks. The IT platform is not yet been finished. Also, the how at primary care level is still not being clear to all of us. Remember, people need to sign consent for this. They need to be able to book before the time. So there's a lot of logistical problems that I can't see that we're going to roll it out within the next 2 weeks if the vaccine is coming in, when the vaccine is going to come in. There's still a lot of work that needs to be done, and it's not done yet.
And just finally, do you think that the healthcare system as a whole is at this point able and equipped to deal with this COVID-19 second wave?
No, don't think so, but it's not unique to South Africa. I think there's not one single healthcare facility across the world that is prepared to deal with this. And that is, and it makes it actually then even worse in South Africa. We should have prepared. We all knew that there was going to be a second wave. Poor preparation, and it's put a lot of pressure onto the healthcare system. And again, that's why SAMA is saying stricter lockdowns is not going to help us. The virus is out there. You're not going to put the virus back under a lid. You're not going to do that. What you now need to do is you need to support the healthcare facilities and make sure that they are sustainable. But we need to get the politics out of the way. There's too many politics.
Well, Dr. Angelique Coetzee, thanks so much for your views from SAMA, for talking to us about the association's view that a hard lockdown will not help the current fight against the second wave of COVID-19. Let's take